everybody. Welcome to Screen Time with today's Communiqué. As we know, September is National Sickle Cell Awareness Month, and I am so thrilled and honored to have Miss Kimberly Lee as a guest today on Screen Time with today's Communiqué, just to talk about all things sickle cell, living with sickle cell, hopes for the future, and just kind of everything in between. So thank you for joining us, Miss Lee.
Thank you for having me. I really appreciate you reaching out. September is Sickle Cell Awareness Month. Our organization, Sickle Cell Support Services of Arkansas, um, we ended it about 2 years ago. So it's been a minute. I'm not part of an organization right now, but I am always available and ready to talk about the disease and bring awareness to it. So thank you for having me.
Yes, ma'am, absolutely. And so just to jump right in and start our conversation, you are living with sickle cell. And so talk just a little bit about the disease itself. How old were you when you were diagnosed with sickle cell? And did you have any kind of symptoms that came about before the diagnosis?
Yes. Actually, I wasn't diagnosed until my early 20s.
Okay.
So, you hear a lot of people say you're born with the disease. I had to be born with it, but I didn't experience a crisis until my later part in my life, to my adult years. I do remember it. I will never forget how I found out, but it was over a weekend, a course of 2 or 3 days. I was 21 or 22, so I had been out for the night doing what young 20-year-olds do, having a good time. And I remember waking up the next day and I had pain in both of my legs and I couldn't move and I couldn't walk and it hurt so bad and I didn't know what it was. I called my mom and you hear this thing of hear about Charlie horses, so that's what I thought it was. And I put icy hot on my legs and I was taking Tylenol and ibuprofen and nothing, the pain wouldn't go away. I even got a heating pad and put it on my legs. And the next day came and I called my mom, and I was a single mom, so I was at home with my two sons, and they were young. So I couldn't even attend to them. And I called my mom and I'm like, Mama, nothing's working. And I was crying and not knowing what I was dealing with, nothing said go to the hospital.
Right.
Well, I have a cousin, a first cousin by the name of Latory. She was born with it, lived with it all her life,
Okay.
and her mom called me to check on me. And when I was telling her what I was experiencing, she said, "Kim, that sound like you're in crisis, sickle cell crisis." Now, I did have kids young. I was pregnant at 15 and then at 18. So when I was pregnant with my first child, I was told that I had sickle cell trait, but
Okay.
not the disease.
Okay.
So my family knew I had the trait. So
Okay.
when my auntie heard what I was dealing with and remembered I had the trait, that's when she put things together and she said, "I think you may be in crisis. You need to go to the doctor." And I couldn't walk, so I had to be carried from my bedroom to my car. And
Wow.
I went, back then it was Doctor's Hospital. Went to the ER, and the ER doctor came in there with this look on his face. Um, After he gave me some morphine, at that time he gave me some pain meds, and he woke me up and he was, "Miss Harris, do you know you have sickle cell disease?" And I was like, "Well, I know I have the trait, but what is the disease?" Because I didn't know much about it. And
Yeah.
he was like, "Ma'am, this is something very serious. What you have experienced is called a sickle cell pain crisis." He gave me some paperwork and told me to go home and research it. And it took me a few years and a few more crises before I really listened to what he said, before I really sought treatment. But that is how I found out I had sickle cell disease, that actually had the disease.
Okay. And so you mentioned that just in listening to you, you mentioned that you have a cousin who was born with sickle cell, and you thought you just had the trait. And
Mhm.
so talk a little bit about the difference between having the trait for sickle cell and then actually having sickle cell disease.
But the difference between she and I, because she was the only other person that I knew lived with the disease. So she's the only one I knew at that time that had experienced anything of what I was experiencing. And I know she was in and out the hospital a lot, in a lot of pain. And there was things she couldn't do that we could do as kids. We're not that far in age. We're not really close, but we're not that far. I think she may be in her early 30s. So we spent a lot of time together, but there were things that she couldn't do that we could do as kids. And I remember my mom or my dad would always tell me, Tori's in the hospital again, or
Mhm.
Tori's in pain again. So I knew she battled with a lot of pain, but the severity of it or what it felt like, I didn't know.
Okay.
So having the trait, I didn't experience any of that. Even when they asked me, have I ever had that prior to that ER visit? The only other time I can recall being in that much pain was when I was pregnant at 15 in my legs. But I was told when you're pregnant, you have Charlie horses.
Okay.
So so I battled it out and never went to the doctor. So that was the only time in my young life that I had experienced something that severe.
And so when you mentioned that your cousin couldn't do some of the things that you and your other, younger family members and friends were doing, what types of things could you guys do that she could not do? Because I know a lot of people who do not have sickle cell disease or don't even really realize they may know somebody with sickle cell disease doesn't really realize what some people can do and others cannot. So talk a little bit about some of the things that you could do that she couldn't do when you guys were kids.
Well, we could play outside longer and
Okay.
for longer period of times or even during really hot days. She had to be mindful about her environment, about being outside in the sun too long or going outside when it was cold or just the changing of the weather, dealing with life stress, just different situations, even sickness. When you're a kid, you may experience illnesses as a kid that some of us could easily take some Tylenol or antibiotic and get over, where her illness could cause, her sickness could cause a crisis to flare up where she has to go into the hospital and be treated. So she had to be very mindful of the physical activities she did, just getting sick as a kid. So, her mom had to really pay attention to the things that she did that our parents be like, go outside and play till the,
Right. Right.
sun go down, or, you get a cold and you can just give you a little Tylenol or something at home. Well, her mom just couldn't be that lenient when she, got sick.
And so, as a young adult, and even now, living with sickle cell disease, are there certain things in your diet that you have to kind of pay attention to? We know a lot of times people with chronic illnesses and conditions have to really watch what they eat, kind of eliminate things out of their diet. Is that the same for someone who's living with sickle cell disease?
Yes, and I just realized I really haven't told you what sickle cell disease is. So let me just let people know who may not know what it is. It is a chronic illness. It does affect the red blood cells, and so many people suffer with the disease. There is no outer appearance for it, so it doesn't look like anything.
Mhm.
A lot of times when people find out, they be like, "I wouldn't have never thought."
Right.
Because it doesn't look like anything, but it is an inherited red blood cell disorder. Someone with sickle cell disease, a normal person, red blood cells are shaped differently than what a person who has sickle cell disease, how our red blood cells are shaped.
Okay.
Ours are shaped kind of like a C shaped,
Okay.
kind of like a sickle, what they call a sickle, and as your blood cells travel through your body, our blood cells, because of the way it's shaped like a seed, they can get attached and start to get clotted, form blood clots, which
Okay.
prevents the blood flow from circulating through your body. That's where the pain comes from.
Mhm.
So you can have a pain crisis anywhere in your body that you have blood flowing.
Okay.
A lot, I can say it took a while. It took years before I started to experience pain crisis all over. It used to just be in my legs, and then it went from my legs to my arms. Well, now I have experienced it in my stomach area, in my back, in my shoulder. I mean, everywhere, all over. I have experienced, even in my hands or in my feet. So I just wanted to let people know what sickle cell disease is. It does affect the red blood cells.
And is there medication that one has to take to manage sickle cell disease, or just, watching what you eat, watching, maybe your stress levels or things like that? Or maybe is it a combination for treatment?
Depending on the type you have, because there are several different types of sickle cell disease. I have what they call beta thalassemia.
Okay.
Don't ask me why I have. I mean, I don't know how they characterize it, but it is not a worst case. It's not a less worst case, but it's kind of one of those in between where I can experience crisis as severe as those on the worst case. And then I can also go a long period of time without experiencing a crisis. But watching what you eat, yes, your diet can help you to experience less crises.
Okay.
Definitely what you drink, like alcohol.
Okay.
And that's what I had to learn even in my 20s. A lot of my crisis came from me being 20 in my 20s and partying and consuming, high amounts of alcohol that would cause me to be dehydrated, that would cause me to go into a crisis. I do take medication every day. It took years before my doctor decided to prescribe it because I didn't have as many crises to
Okay.
really be on medication. But when she started to see me having more, then she did prescribe me something that I take every day. And I can't remember I know what the name of it is, but I don't want to say it incorrectly because medications have such weird names.
Yes.
But the reason why I take it is to help prevent crises.
Oh, gotcha. Okay.
And I believe it helps, but with sickle cell, any anything can cause you to go into crisis mode.
Gotcha.
So even the changing of the weather, stress, sickness in your body that you may not know you have that your body's trying to fight off.
Mhm.
So although I'm taking the medication to have less crisis, but it could be environmental things or things around me that I don't know how to deal with that can cause me to go into crisis mode as well.
Right. So,
Exercising is good too. It helps
okay.
decrease the level of stress and kind of keep the blood flowing in your body. So, yeah, there are a combination of things that you can do to help yourself live better with sickle cell disease.
And so I know that some people have to get to the point where when they're in the hospital, they have to have like blood transfusions, things like that. Has that been your experience in battling with sickle cell disease?
Yes, have had, I couldn't even tell you now. I used to keep up with how many blood transfusions I've had because it wasn't so many, but I've just stopped counting. But yes, I have had several blood transfusions. Being since, if I've been hospitalized, they do check your blood count on your regular routine visits.
Right.
My blood count level, I think like 11 and above is really good. My average is like a 9. So
Okay.
anytime I go, my hemoglobin level goes from a 6 below, then my doctor do suggest me getting a blood transfusion. But anything after the 6, between a 6 and a 9,
Mhm.
is my average. Even though an 11 is good, but a 9 is an average for me. But I have had several blood transfusions. Some people living with sickle cell disease because you're anemic,
Right.
they may take iron pills. Well, with the one that I have, the case that I have, my hematologist don't even prescribe me iron pills because she said it really wouldn't help me that much in that area. So
Okay.
even with the blood transfusions, they may get they may take iron pills, and I go in for IV fluids just for IV fluids just to get hydrated.
Hydrate.
When COVID happened, and so I would be prepared or better.
Mhm.
I would take better care of myself. I went in just for fluids. Sometimes I can just go in just to be hydrated. I drink plenty of water, but sometimes that extra hydration can help me when it's something like the flu season or what we're dealing with the coronavirus.
Oh wow. Okay. Okay. And so you mentioned that you have two sons, and there is a genetic link or hereditary link with sickle cell disease. Have you had them tested, or have they been tested for sickle cell disease? And then how? The next question is, how has family support, the support of your sons, the support of your husband, help you navigate handling sickle cell disease and the crisis that may come about?
I do have two sons, 24 and 21. And my youngest just had a baby, so that's why I have this headset on because we have the grandbaby here, and I want to make sure the outside noises don't interfere with the interview. But no, neither one of them have the disease or the trait. Thank you, God. We did have the grandchild. I mean, they do test. I think in the 80s is when they start testing all babies. I'm a 79 baby, so I missed that age group of being tested. But now they test all babies. But my family, it took a while because we really didn't understand it. And then me being the one living with it, I
Right.
didn't do everything I was supposed to do. So it took me a few years
Mhm.
to really understand what I was living with. It took a few hospitalizations. It took a lot of pain and some crying nights. But once I understood it and I started to do better with it, my family were able to be that support system as well. My husband, when we first met, and I told him that that I had it, he researched it.
Okay.
He started to research it himself so he could learn more about it. And even when I'm in my worst pain, I could just see the look on his face because there's really nothing he can do to make me better. You can't rub the pain away. You can't hold the pain away. Sometimes you can't even touch me.
Oh
Like
wow.
you can't even touch my body. The pain is that bad. But learning about it, being that emotional support, he has been that. He is my biggest advocate when I'm in the hospital and I can't speak because I may be medicated or in so much pain that I'm crying. He is speaking for me and he is making sure that they're taking good care of me. And people living with sickle cell, they have to have that advocacy because we're looked at differently in the hospital.
Mhm.
When we go in, we're looked at as drug seekers because narcotics is what they give us to treat our pain.
Mhm.
And like I have to express to people when I go into the hospital, yes, I need pain meds. That's why I'm here. The
Right.
only way I'm going to get better is if you administer me pain meds through an IV. What they give me in the hospital, I have at home in a pill. But if you can't get ahead of the pain,
Right.
then you have to get that IV treatment. And because it doesn't look like anything on the outside, and they look at other factors to determine if you're really in crisis, if your
Yeah.
blood pressure is not elevated, they want to say you're not in pain crisis. That's not true.
Mhm.
And they want to determine your pain crisis by the way you look, not the way you feel.
Right.
And being an advocate, I stress that a lot. I've had some very disappointing visits here at some local hospitals where I had to voice my concern because at any moment my life could be taken and you're not wanting to treat my illness could affect that, can cause that.
And speaking of advocacy, there are lots of families out here who have children who are dealing with sickle cell disease, or they themselves are dealing with sickle cell disease. So, what bit of advice or words of wisdom would you offer families to cope and to get through situations when a crisis comes about?
I would tell family members that have family members that's battling the disease, listen to them. Know their signs, know their symptoms, know when they're in crisis and listen to them. And when they're in crisis, don't just pacify it. Get them the help that they need. If they need to get to the ER, get them to the ER. If they don't have a specialist, it is very important that they seek a specialist. Fortunately for me, I've been able to have good jobs where I have good health insurance.
Right.
So I see a hematologist regularly, and I've been seeing her since probably my mid or late 20s, Dr. Wilder at Carti, and her and her team are amazing. She's taken really good care of me. She's listened to everything. She don't question anything I say, and she knows me. So, family members, you have to be an advocate for your loved ones who's living with sickle cell disease. Sometimes they can't voice what they need or how severe the pain is. Um, and you have to go to the doctor appointments with them. Tell the doctors what they're not telling them. Sometimes we as sickle cell patients, we're scared to tell the truth to our doctors because we're looked at differently.
Mhm.
And sickle cell disease can affect any race because it's a inherited blood disorder, but the majority of the effects are African Americans. So when we go in saying we're in pain and we need a narcotic, they don't they don't look at us as how they look at other patients.
Right.
They look at us as drug seeking. But being that family member that's an advocate, you have to tell them, no, my wife, my husband battles this disease, and this is the only thing that's gonna work. And know what pain meds work. With me, Dilaudid. I'm sorry. Yes, Dilaudid works, and
Okay.
even with Dilaudid, it makes me itch. So even with Dilaudid, you have to give me Benadryl.
Okay.
Well, Dilaudid also make me nauseous. With Dilaudid, you have to give me um, a nauseating medicine. I'm allergic to Zofran. Now in the hospitals, they won't even give you Phenergan through an IV. Well, I can't take Zofran, so you have to give me Phenergan. You have to know these things, so when your loved one go to the hospital, you're able to advocate and tell that doctor that. Because sometimes I can't tell the doctors that. My husband would tell them that, and even though it's in my chart, what works for me, they would still question it. Well, what about morphine? Morphine doesn't work for me. They think you're coming in there asking for something strong because you're drug seeking, but no, you're asking for something because you need relief.
Right. Right.
So family members, be that emotional support, be that advocate for them. Attend doctor's appointments if you can. Go to the ER with them if you can, and encourage them to speak out about it. That's another thing I learned about people that live with sickle cell disease. They don't
Mhm.
like to speak out about it, and I don't understand why. You can't look at someone and say they have sickle cell disease, and
Right.
you never know who around you may be battling the same thing you're battling, and you
Right.
have to tell your story. But a lot of times we don't want to be looked at different. But if you have that support from your family, your loved ones, your community, you'll tell the story. You'll encourage other people. So that is what I would tell family members. And those who may have it themselves, but also have a child or a
Right.
loved one with it, get the best doctor care that you can. Make sure that you are watching your triggers. Make sure that you're knowing the triggers for your child. Make sure that you're paying attention to your child cries. There's
Right.
a different cry for when I'm hungry, when I'm in pain.
Mm.
Know that.
Yeah.
Um, Luckily for me, my parents didn't have to experience that. At look for my parents, they didn't have to experience that. But as an adult, they had to know when I was in pain, I was in pain. If I need you, come.
I think that's good stuff because you mentioned advocating for your family member, and then speaking up for them when you're in the hospital and the caretakers are not paying attention to you. Then speaking up, either you, the person who's having a crisis, or the family member, a loved one, speaking up and speaking out for that person, advocating for them to get them the help that they need is so important. And I thank you for mentioning that, because a lot of times people are afraid, I think, or hesitant
Yes.
to question a healthcare provider or a healthcare worker because they're known as the experts. True, they are the experts.
Yeah.
They are experts, but
That's
nobody knows you and your body like you do.
exactly.
Nobody can advocate for you like a family member or a loved one who's with you. So I appreciate you putting that out there, not only for sickle cell disease patients, but anybody who
Yes.
needs help in the healthcare system. So thank you for mentioning that.
You're welcome, because a lot of times the ER doctors, they just want to give you something to send you home. I've had that experience too, and I would tell them, no, that's not going to work. Get your manager in here because I'm going to come back.
Right.
I'm going to come back in a few hours, or I'm going to come back the next day. And you're not going to send me home in worse pain. The longer I'm in pain, the worse the pain has become. And you're not going to send me home in worse pain that I came. And that scale of 1 to 10, don't ever minimize your pain level. It's always a 10. No one wants to be in pain. If
Right.
I'm in pain, it's a 10. I can't say it's a 3 or a 5 or a 7. I'm hurting. It's
Right.
definitely not a 0, or I wouldn't be here. And I had to learn that over the years.
Mhm.
Just routine visits to the ER, looking at how, if you say you're in a set, your pain is a 7, how
Mhm.
slowly they are to get you to the back, if rather than if you said your pain is a 10. How
Right.
you're treated different if you say your pain is a 5,
Mhm.
as to if you said your pain was a 10. So I've always said it's a 10. If I'm here, it's a 10.
I'm in the ER, so apparently, yes, is that is
Exactly.
that I'm here. So, yes, ma'am.
But
So,
don't be afraid. Don't don't feel like you can't voice that. Do be an advocate for yourself, and your family members be an advocate for your loved one.
right. So, what do you think are, or what are your hopes for the future with sickle cell disease? I know that there are some newer treatments that are out there. Have you had the experience of trying some of the newer treatments out there or hearing about them? And so, what are your thoughts as someone who's living with sickle cell disease about them?
I have heard UAMS have a sickle cell clinic.
Okay.
Shout out to them. Last year, I experienced the worst pain crisis ever, where I was hospitalized for 29 days in pain for probably 2 to 3 months.
Mhm.
But after my doctor only treats a level of sickle cell. So when she realized that where I was at that time, she could no longer provide the service needed, she sent me somewhere that could. And it took a lot of her to say that, Kim, I'm sorry, there's nothing else I can do. Let me send you somewhere where someone can help you. And I was able to go to UAMS, to the sickle cell treatment center there, and they did amazing. They found the infection that I had, did the surgery. I've recovered. Here I am over a year later. But they have really a symposium that they have every year around this time. This year it's going to be virtual. I don't have the dates yet. I actually did a interview with them. They kind of did it different and had some patients come in, some people living with sickle cell disease, asked us some questions, and we was able to talk about, same here, talk about living with the disease. But a couple years ago, at the symposium, they talked about the bone marrow treatment,
Okay.
and a lady who went through it is not here in the southern states. It's on the east coast, I believe. At that time, that's where you would have to go. It's very expensive, and it would take time away from your family and your friends. You would have to go live there for a period of time.
Okay.
If I would love to have that. I would love to try that. Unfortunately, financially, I can't. But individuals that I read articles about individuals that have and have been cured
Okay.
from the disease. Learn about it. If it's something that you can afford, you and your family can do, I would say learn about it, research about it, and go for it. If not, then just continue to educate yourself about things you can do. That is the only cure that I heard of. For a while, there was no cure for sickle cell disease, only treatment.
Right.
But the bone marrow is, they're saying now, is a cure. It just costs money. But I hear about different things. But I have a specialist that I see, and she'll let me know what she think would work for me. I really listen to her, and I believe she would guide me in the right direction. So I'm
And
not gonna be out here experimenting, but things that she tell me to try at home, I do, or things that she gives me to do, I do use, and she'll make sure it's the right thing before she say do it or use it. So
okay. And so, just one final question. What do you hope that or what do you want people who are not living with sickle cell disease to know about someone who is living with sickle cell disease? What do you want the general population, someone who may be watching this, who doesn't know anybody with sickle cell, never heard of sickle cell disease, what do you want people to know about those people who are living with sickle cell disease like yourself, living through it every day?
The same thing I've always said. I want people to become more educated about it. I know there are a lot of other rare diseases out there. I know there are plenty. And we can always talk about the main ones, but there are people suffering from other diseases that does not get the focus, the attention, or the financial support as other diseases. And people are dying
Mm-hmm.
from the disease. I think this year we lost, oh my God, maybe here, just in the surrounding areas, I think we lost 3 individuals that I know of thriving. I can cry now just thinking about them and just seeing them so young.
Mm-hmm.
Excuse me.
Mm-hmm.
Just seeing young ones not to
Mm-hmm.
fulfill their life because of this battle that they wasn't asked to be born with.
Right, right. But I think that it's good that you speaking out, um, giving it the voice that a lot of times goes unheard, using your platform, using your voice, speaking to it, giving it life, speaking truth to it, because, like you said, you live with it every day. You know what it's like to have a crisis. You know what it's like to advocate for yourself and having encouraging family members to help advocate. I think that that is one of the ways that we can bring about change is giving life to it, giving voice to it. And so I appreciate you giving voice and speaking on behalf of yourself and everyone who suffers and lives through sickle cell disease every day. So I appreciate you for even taking the time out of your schedule just to be with us to share your experiences.
Well, thank you for having me. And also, I want to encourage people if you can donate blood, donate blood. Blood is very essential to those living with sickle cell disease. It affects the red blood cells. Um, 1 unit can help save up to 3 lives. So I know I've been a blessing because of people who donate blood. If you can donate blood, do that. If you can give to an organization, do that. Arkansas, I believe, now has a new sickle cell organization called SOAR, Sickle Cell of Arkansas, I believe. They're on Instagram and Facebook.
Okay.
Search for them. I believe Deja Blue is having a big softball tournament that is raising money for the organization next weekend, this coming up weekend.
Okay.
He's promoting that on his page as well. Um, Find a way to donate. I know one thing with being part of the previous organization, it was a hard push to get people to support sickle cell, the organization financially. And we were a help to help people pay bills because when you have a crisis, sometimes you're out. I was out from April to August of last year.
Wow.
So if it wasn't for a good job, I don't, and supplemental
Right.
insurance, I don't know how I would have sustained, but everyone don't have that.
Right.
But it's a crisis that can take you down and take you down for a long period of time. So people need the financial help, people need the emotional help, people need just the support. So find that organization SOAR, SOAR, I believe it stands for Sickle Cell of Arkansas.
Okay.
They're right here in the state. You can also go to Deja Blue's page for about the softball tournament that's raising money for it. So find a way to support it. Give blood whenever there's a blood drive, and just educate yourself about it. It is something that affects the minority population, and you may know someone that live with it. You may just don't know they're living with it. So that's what I would tell anybody, and I encourage everyone. And I hope I've been a help to anybody.
Absolutely, you have. And I just appreciate it once again, you taking some time to share your experience, to advocate for yourself and for others, and just to bring an overall awareness to sickle cell disease. So thank you so much for sharing some time with us today.
Thank you for having me. And anyone else want more information? I don't mind giving my name, a number. My name Kimberly Lee, and my email is LADYKIMLEE. And you don't have to wait until September to learn about it. Yes, September is Sickle Cell Awareness Month, but people like me, we're battling it every month, every day. So if you want to learn more, you can always go to the CDC website, Arkansas Minority Health Commission here. I know they share information about it, so it's information out there.
All righty. Thank you so much, Miss Lee. And that's a wrap.
Thank you.